You're listening to a CNA podcast.
I do not like hospitals. Not many people do. But having access to good, clean, functioning medical facilities is an unattainable luxury for millions of people worldwide. Imagine waking up mid-surgery because your low-quality anesthetic has worn off. I'm Teresa Tang. In this episode, we're going to explore the issue of healthcare disparities with Buena Bernal, our Philippines correspondent. She dissects the country's ailing system and what is being done to help the people it's failing. Buena, hi. I have missed catching up with you. It's been quite some time since our last episode. Welcome back to CNA Correspondent.
Always great catching up with you, Teresa.
Can you take us to the Philippines? It's a place where you were born, where you were raised. Walk me through what exactly happens if you're an average person and you fall sick.
Well, it really depends on your medical condition. But in general, if you're hospitalized and it takes months at a time for you to recover from your disease, then health spending can be catastrophic. And I'm not using that word just to incite panic. Catastrophic health spending is actually a technical term in the health sector that refers to the amount a household pays that exceeds their capacity to pay for healthcare. In other words, it can be impoverishing for them. And in the case of a TV story we did on Philippine healthcare, we spoke to multiple patients with that experience. And that goes at the heart of universal health coverage, because what universal health coverage really means is access to healthcare in a way that does not push you into poverty. If you look even at the experience of the Philippines during the pandemic, stories of people having to pawn their properties in order to pay for their hospital bill because they contracted COVID-19 at a time where it was still very fatal to get COVID-19.
You talk about how expensive it is if you fall sick for a long period. And, since moving to Singapore 8 years ago, my local friends here, they've warned me many times that it's cheaper to die than to fall sick in this country. It's sort of said tongue in cheek, but there is truth to it because medical bills, they can get so expensive. And it sounds like that's what's happening in the Philippines.
That's right. And the main premise of our TV story on health was actually the fact that the main driver of health spending is medicines. So as high as 75% of out-of-pocket health spending for the poorest Filipinos and 58% for the richest goes to medicines. And essential medicines, not all medicines, but the essential ones, we do have a national drug formulary that lists what are the essential medicines that the government can buy at a cost-effective rate, is at least 3 times more than international prices. That's according to government data. So when I learned of that, my immediate thought was, is there anything else that we should talk about but this? Because if it's 2/3 of your health spending, and if health spending is so catastrophic, then we should talk about access to medicines. And part of the conversation that we had in filming the story, the TV story for health, was really the idea that poverty is an exacerbating factor for lack of access to healthcare.
Buena, I was immediately taken in by your TV story because right off the top, we meet a Filipino mother of 4. She basically breaks down in front of you. She was so forthcoming talking about her health, her financial struggles. Tell us more about Amelita Depra. How did you find her?
Oh, one thing I would say is that for every story we do the research, we put in the work, meaning to say we ask ourselves, what are the most important elements if we have this much time to talk about healthcare? So in this case, we have half an hour. What are the most important things we can talk about? And in the case of Amelita Depra, part of our discussion was, where should we go? And we thought we should go, of course, to hospitals, the basics. But beyond that, for the social factors involved in health, we should go to churches, and we should go to pharmacies, and we should go where people can buy herbal medicine. So we actually met her at church. And part of the reason why we went to a church is because we had this conversation about how Filipinos, when they don't have access to life-saving cures and they're really at the brink of desperation, they go to church, and, faith is something they hold on to. So we met her after she was actually praying for a job abroad. And right after she prayed, she went straight to where she could buy herbal medicine. And that's how we learned that she actually had goiter.
When you tell us about Amelita, we learn that she's using supplements instead of medication because she has access to those supplements. And you can get those things and much more on one particular street in Manila, right? Countless pharmacies line Bambang Street. Tell us about that.
Well, Bambang Street, the pharmacies there actually sell wholesale, and they're selling generic drugs. And that is why it is cheap to buy from there. So how cheap it is, I've spoken to buyers there and compared prices of when they buy it elsewhere. It's 3 times cheaper. That is why there's really part of covering this story is really going there and learning about the people who buy medicines from that place. The supplements or the herbal medicine that we covered, they're near the church where we met Amelita. That sidewalk, it's not in Bambang, but it's also known for those herbal medicine. When we went there, I guess the takeaway from the fact that this is sold wholesale and this is generic drugs is the fact that, of course, that there should be strong legislation for these generic drugs. And in the Philippines, there is actually. And doctors I spoke to would explain bioequivalence and the fact that generic drugs are nearly as effective, meaning to say there's just a small percentage as the branded medicines. So it's important to have that as well. But the other conversation happening there is that medical facilities in the Philippines and localities in the Philippines buy medicines separately at different volumes, at different price points. So there has been a conversation about how you can create a national pool of medicines and just figure out not necessarily a blanket distribution, but a targeted distribution, meaning to say that you've already surveyed the needs prior, meaning you've spoken with the hospitals and with the localities about what their needs are. And then after that, you create a national pool where you do the distribution yourself. And that might be cheaper than having all these small purchases at a time. The other conversation about procurement that we had is this conversation with Dr. Gap, who is the medical director of the Philippine General Hospital, who shared in a Senate hearing how in the middle of operation, a patient woke up because of low quality anesthetics. And that just shocked the legislators. And that's a conversation about how the current law for procurement, he said, is not in line with basically the interest of the patient, because sometimes the current law forces medical facilities to buy the cheapest one in the market, which may not be the best one. Dr. Gap was saying that this may work for supplies like pencils, in the Department of Education, school chairs, but medicines is a different item altogether that should go through much stringent quality control measures. So sometimes we think of big pharma as a big bad wolf in terms of access to medicines. But in our case, when we spoke to Michelle Irwi, who is the global head of access to medicines, we were really impressed at how they were making medicines more equitable, especially in the global south. Let's hear what she has to say.
We group our countries into different tierings. And these tierings is determined with regards to the economical dynamics of a country, so the GDP, the healthcare infrastructure framework of a country, the out-of-pocket segment, as well as the policies and enabling access to specific therapeutical areas. So pricing is determined on these economical factors and the dynamics of these countries.
One thing that never really crossed my mind is the link with geography. There are 7,000 islands in the Philippines, Buena. That poses a big challenge, doesn't it?
That's right. When I spoke with a former health minister, Pulino Bial, she was saying that this is really one of the biggest challenges of the health department, which is the storage and distribution of medicines. And, we talk about how do you transport these medicines to these islands? You look back to the pandemic where they used helicopters to bring COVID-19 vaccines to remote islands in the Philippines. And on a regular basis, you just can't do that with the resources of a lower middle income nation like the Philippines. So logistics is part of what makes medicines less accessible in areas that are far from urban centers. But it's not just medicines, it's also medical facilities. Because if you have these areas where, for example, you have indigenous peoples communities who aren't registered voters, then there's very little incentive or political will for elected officials to cater to their needs. Because at the end of the day, sometimes it's about how big is the voting populace in that area and what kinds of services should I prioritize in these areas. So it's not just about logistics. Sometimes it's also about political will.
Let's talk about the patients again. Patients inside hospitals are actually considered to be the lucky ones in many ways, right? Because the alternative is waiting on the sidewalk outside. Describe what it's like for people on the pavement. I can't believe this. So people are outside just waiting.
That's right. If you go around the compound of the Philippine General Hospital, right at the back are people living on the sidewalk. And I'm not even sure if this is too graphic to share, but on the 4 times that I went back there, there is a certain smell on that sidewalk. And it's not garbage, it's not sweat. It smells like mold, and it stays with you hours after you stay there. And my conversation with my team was, do you smell me? Do you find that distinct smell every time I go and stay on that sidewalk, speaking with the patients there? And they said, yes. And they all said, it smells like mold. And that's when it hit us as a team that, how do they clean that area up when there is always someone there, living there? There's no time to clean the sidewalk because it's just one patient after another living there. And the reason why they live there is because sometimes they come from provinces outside of Metro Manila and they don't have the money to go back and forth to Philippine General Hospital where they can get free services. And that's the only hospital in the greater Metro Manila area that can cater to their needs. So at that cost, so by the way, because there are private hospitals, but they can't afford them, so they stay there for months. And that means there are outpatient services that they wait for sometimes in multiple days for a month, and they just sleep there waiting for the next schedule. Sometimes they're a relative of a patient and they can't stay inside the hospital. Maybe they have an infant with them, things like that. And Dr. Gap, the medical director, has done strides to provide for the needs of the patients of the Philippine General Hospital, but it's really just too many needs. Their emergency room is catering to patients twice its capacity at any given day. And so he's shoring up funding support from legislators, from philanthropists. He's already set up a dormitory inside the Philippine General Hospital, and yet there are still people living on the sidewalks. And I think this is a testament to the kind of service that this hospital provides to the Filipino people. It's not like this is a secret. People know that if you want to get the best service, medical service in this country, you go to that hospital. But at the same time, sometimes we speak to people who fall through the cracks. So these are the people living there on the sidewalk, because we do want to highlight that there are still these problems that exist.
My mother's a nurse. She's been one for 40 years, and I know firsthand how medical professionals are really at the heart of any healthcare system. And it's hard to believe what some in the Philippines are going through, Buena. Low salaries, poor working conditions, you name it. And then you have post-COVID now, a lot of the issues they were dealing with have only gotten worse.
So we spoke to various union leaders across the political spectrum, from the far left to the center left, where there was a common theme in our interviews with them. This is basically the delayed health allowances that were promised to them during the COVID-19 pandemic. And it's not like these allowances are growing in interest, the more that you delay paying them to these health workers. No, it's just the same amount, but they're just waiting for it. And in my case, I was able to speak with center-left union leader who said, my wife has a chronic kidney disease, and this amount that the government owes me could have gone to her dialysis, to her medicines, but I'm still waiting up until now. And I guess, we could listen to health workers' rights activist Robert Mendoza, who explains to us what's driving low morale among health workers.
The government has no genuine care for health workers. 1, we've always called for a living wage. Health workers in the Philippines have the lowest pay in Southeast Asia. 2nd, the work is inhumane. The ideal ratio is 1 nurse for every 12 patients. That's not being met.
And some nurses can't even leave their work behind them because patients literally show up at their door at home. I know you took a 2-hour journey to visit healthcare workers in island communities. What struck you about them?
So the boat ride was 2 hours, but to get to the port that takes us to that island is another 3 hours or so.
Oh, wow.
And I would say that Talim Island, which is in the middle of the Philippines' largest lake, isn't it actually a remote area? So there's a technical term called the geographically isolated and depressed areas, and Talim Island isn't even part of that list. So there are even more remote islands in the Philippines that we were unable to go to because of the time frame. And so we chose Talim Island, where I met this wonderful nurse named Rose, who was so dedicated to the job. And she was telling us, patients would go to her home because they know her as the island's nurse. Mm. And sometimes, we complain of overwork, but literally this nurse is opening up her home to the entire island.
We have nothing to complain about, I think.
Correct. De facto rural health unit. And what's even, impressive about this nurse is just how happy she is with the work, how meaningful she finds that. Because if you ask her, what are the challenges here? She'd say, the challenge is transportation. The challenge is sometimes that people would be mad at her for the lack of facilities in their rural health unit. And she'll explain, this is just what we can provide. So given your case, you would need to go through that 2-hour boat ride and go to the mainland and be in a hospital there, because that's not what we can deal with here. So she has to explain that to them. But she lights up when I ask, what's the best part of the job? And that's when she says, when a baby cries after birth, you hear that first cry. That's the best part. And she says when she walks around the island, sometimes mothers would come to her and say hi, and she would see that the baby she helped deliver is already, 4 years old, 3 years old. and that's just, it's a small island. So just knowing that a lot of kids growing up there, that she helped deliver them in that 2-bed capacity birthing facility.
Buena, we've talked so much about the problem. What about the solution? What is the government doing to get things under control?
I guess part of the solutions is really expanding that pool of funds for medicine. And that's the challenge, right? Because doctors, including former health ministers I spoke to, such as Dr. Enrique Ona, said that we really have to accept that right now we can't cover everyone's health expenses, for free. And he said, I was on the board of state health insurance firm PhilHealth, and up till now, I pay for my premiums and I don't even get services back. So kind of an acceptance that that's where the Philippines is right now. That's why advocates are saying, let's focus on primary health care so that, there's early diagnosis, there's preventive health care, and there's a chance to cover everybody, because right now the funding for healthcare, the Department of Health can't even pay for the health allowances of the workers that were promised to them, and can't cover everyone, all their health expenses. But in terms of access to medicines as well, the plan of the government is kind of to create these zones that would provide tax incentives for pharmaceutical companies. Let's hear what Albert Domingo, the Philippine Assistant Secretary of Health, has to say.
We have to promote competition. There has to be many more brands, many more companies coming in. So not only do we allow products from the outside, but if we can actually manufacture those products locally, then why not?
You have won awards, Buena, for your reporting covering development and human rights issues. Clearly, you're passionate about this topic. Do you feel like telling the story of healthcare inequality in your country amplifies the cause? Can it make a difference?
Well, I find that when we cover development stories, part of our job is really to look at a social problem from different angles. So we speak to a variety of people, but at the same time, we speak to those who have an idea of what to do. So look at the social problem from different angles, but also look at the possible solution from different perspectives. I keep mentioning Dr. Gap because the medical director of the Philippine General Hospital, because even before trying to brainstorm for this story, when I speak to doctors and I ask, who do you think we should speak to? His name kept popping up. And I would say that interview with him gave me an idea of what are the motivations and drivers of people in the medical sector in the Philippines who stay. And that was an important part of the story because it's not just about those who migrate because they're forced, out of economic coercion and things like that. But Dr. Gap in particular said, if you want to be a great doctor, which he is, by the way, he's the only Filipino who has spoken to Harvard about this brain surgery that he was a pioneer of in the Philippines during his younger years. So say this is a guy who could have been in any other OR in the world, operating room. And I asked him, why did you stay here? What you don't hear in the TV story is him telling me that, if you want to be a great doctor in the Philippines, which was his priority during his younger years before, all these needs in the Philippine General Hospital struck him and forced him to become medical director. He said, if you want to be a great doctor, you train abroad because that's where the cutting edge technology is. But what I did was use that as a challenge to bring the cutting edge technology here. And I think when you meet visionaries like that, it just kind of helps you understand or go through or navigate through that vicarious trauma. Because while there are cracks in the Philippines, there are also people who are trying to work on those cracks and really trying to forward that cause for universal healthcare in the country.
So much more to the story than just what made it to your reports, Buena. Thank you so much for this deeper look.
Always great speaking with you, Teresa.
And a reminder that the TV episodes of CNA Correspondent air every Wednesday at 9:30 p.m. Singapore, Hong Kong time. And you can find Buena's reports on YouTube as well as on cna.asia. The team behind this week's episode is Saya Win, Clara Ong, Crispina Robert, Craig Dale, and myself, Teresa Tang. Thanks for joining us this week.